morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty. Today we're here with Tracy Thomason, and we're going to be talking about Savida Healthcare, a new program that's opening right here in the building. But first, Marty with local events.
So at the Bellows Falls Opera House, it's a mystery. Maybe it's a comedy. Maybe it's an action film. We're not quite sure. It is definitely not that, though. And so if you, there we go. But the classic movie, I do know, the classic movie is The Natural with Robert Redford, and that's being sponsored by Coda and Coda. There's also a special event happening at the Opera House. It is a movie series. It's movies about changing the world. It's a 4-week series of films on activism. The actual filmmakers will be at the various movie showings. So there'll be a showing of the movie, and then there will be a discussion afterwards. And it all starts out with a movie called Far Out, which is the history of the Packers Corners commune, which it's really, you have to at the very least go and look at the trailer for it because it brings you right back to the 70s.
Yeah.
A bunch of people moved to Packers Corners in Vernon, and then there was another commune in Montague, and they just wanted to be farmers, and they wanted to get away from the city, and then they became activists. And you said their thing
was about nuclear power. That they thought that it was bad, and what would you do with nuclear waste? So they wanted to sort of curb nuclear power.
So it's kind of, we've kind of come full circle in the need to have a call for activism, and so it's a good time to go check out those movies, and if nothing else, the nostalgia of the time, the 70s.
Anyhow, and I have a couple.
Okay.
First is this weekend. It's September 6th. Westminster West Community Fair is going on, and it's going to be a community fair with a 5K and a chicken cookout and music, white elephant auction, and a whole bunch of other things in Westminster West. So it's going to be a pretty good community.
That's a lot of things to happen in Westminster West.
It is, because it's not very big. And it is right in right where all the roads come together there. That's where the event's taking place. And then the other event is Music on the Meadow. It's a fundraiser for cancer research and treatment happening in Chester, Vermont this weekend, and it has some of our favorite bands, Intercept and The Illusion, and they'll be out in the motel in the Meadow, and I think it goes from like 11 to the evening.
Into the evening.
Yeah. Fun event. Everybody enjoys it. It's been going for I don't know how many years.
Easy to find. Good parking. That's always a big one. There's good parking. It's just right off of Route 11, just past Stonehearth Inn.
Great. Well, Tracy, welcome to the show. Can you tell us a little bit about Savida Health and the program that you're working on?
Yeah, so Savida Health, we are an MAT program. We're in 7 states, and we have a little over 50 clinics.
What's MAT for us?
For us lay people.
So MAT is medication-assisted treatment. It's also known as MOUD, which is medication for opiate use disorder.
So it's basically for people who are using opioids or alcohol who want to get better and stop using, and you use the Suboxone to do that?
Yes. That's exactly what it is. Yeah, so it comes in 2 different forms: sublingual, which is a film that dissolves in your tongue, or you can get injectables.
And what's the advantage of one over the other?
Time. Some folks also like to come in and just get one and done. Traditional days we did methadone, which is every day, and Suboxone isn't like that. So you could come weekly, bi-weekly, monthly.
I remember that was always a problem with methadone, is people had to be able to get on specifically people in Bellows Falls had to get on a bus, go to Brattleboro, and spend the day to get their methadone, and then have to come back. And so you basically couldn't work.
Yeah.
It was a real problem because it was a daily treatment that you had to do. So if you could do it 1 per week, that would really make a big difference.
Yeah, really big difference. And it just depends on the provider and the patient who goes which way or the other. Are they going to do the sublingual, or are they going to do the injection? That's really personalized, but both are really good options.
Yeah. How did Savida start, and where did it come from, I guess?
So I think it's been 9 or 10 years, don't quote me, but there was our medical director, she's still with us, she's retiring this year. She started Experience Wellness in Massachusetts.
Oh.
Yeah, and then our CEO who just retired, he ended up working with her and expanded it, obviously changed the name to Savida Health, and expanded throughout New England. We're also in Virginia, very large
Wow,
presence in
yeah.
Virginia, and Delaware, and Tennessee. So yeah, that's how it happened.
Does Savida stand for something?
So it's so funny. So I asked him this, and he said that basically part of the word stands for love, and then he just made it sound good with Savida.
Oh, okay.
Yeah.
Okay. We actually have a
That's good.
video that, because
Oh,
you have
yeah.
a lot, you offer a lot.
Yes,
right? So
we do.
let's go to the video, and that can give people a good visual.
From the moment you walk through our doors, you'll feel the difference between other outpatient recovery programs and Savida Health. We believe that humans need connection and a smiling face. Some people say connection is the opposite of addiction, and we couldn't agree more. That's why Savida has a team of people you can connect with. From the clinicians specifically trained in substance use and mental health, to the peer recovery coaches and case managers, our team is here to connect with you without judgment. Today is the day. This is the year to get connected to an amazing team who truly cares about your recovery. Visit SavidaHealth.com, click on the orange Get Started button, and someone will call you, often within hours. We want you to visit our office and feel the hope that comes with the team who will walk this recovery journey with you. Today is the day to make Savida Health part of your long-term recovery.
Wow, that's amazing. Nice video.
Thank you. Yeah.
So I was preparing for the show, and so I was looking for the video and things that we could put up, and so I looked through your website and your Facebook page, and one of the things that I constantly saw listed, especially on your Facebook page, you have a good Facebook page. Whoever does your social media is doing a good job.
Thank you.
There was a lot about connection, making connections, because we know that connections, opposite of addictions. And then there was a lot of just uplifting information. And I thought that even if somebody wasn't maybe quite ready to commit to your services, there's a lot of good information on both your website and, which is SavidaHealth.com, right?
Yep.
And your Facebook page. And one thing I want to go back to when you were talking about medically assisted treatment, but you called it another name.
Yeah, so it means the same thing, but you know, the world is ever changing with acronyms and names, and so they're moving towards MOUD, which is essentially the same thing, but it's more specific, medication for opiate use disorder.
So is opioid use disorder, is that now a technically medical term,
Yeah.
like it's a medically treated, like what is it what is that?
DSM.
Yes, DSM. So that's kind of, is that a fairly new
Yes,
thing?
some are still MAT, but we're trying to get there, right, to the MOUD. Like just like some of the terms, like it's return to use. It's not relapse, because there's been a negative connotation with relapse. So same.
Well,
idea.
that's kind of what I was thinking. I was thinking there's a huge negative connotation towards addiction, and now recognizing it as a disease that needs to be treated as a disease, and taking medicine. Sometimes we have to take medicine for various diseases like high blood pressure,
Right.
Diabetes. So you offer a medicine to help treat this disease. I'm just trying to, because there's a lot of
Yes,
there's a
you're
lot of
right.
stigma
There is.
around medical treatment of addiction, or just addiction in general.
There
And I think
absolutely is.
you even have a nice little saying, something about don't stigmatize it or something. So you also talked about how you are now working with directly with first responders. Do you want to talk a little bit about that program?
Yeah, so Vermont is part of the PREVENT program, and so what that means is we partner with EMS and other partners, not just Savida Health, but other recovery MATs, MOUDs, recovery centers, like Turning Points and Journey to Recovery and all of those. And so what happens, your EMS, you're on the truck, and let's say you found someone in need of Narcan, and so you give them Narcan. You can offer them, EMS now has the ability to give them their first dose of Suboxone, and then can refer them to Savida Health or another partner, to Turning Point, so they can get a peer specialist, things like that, whatever they need. And so the goal is to let their recovery starts now. We all talk about that when they're ready. It's now and not wait. And so our commitment is we will get them in time for their next dose, right? So it's 48 hours, because if it happens on a Friday, we're not open on the weekends. But that's the commitment that we've made with the local EMSs, and it's incredible. I mean, it just says a lot about Vermont and what we're willing to do as a state to help our people in need.
Well, it's meeting people where they're at, and that's
literally,
and I think that's the key, because you're right. When someone might only have that tiny little window when they're really ready, and if they can't get the treatment, they're probably gonna maybe go out and use again, and then they're not ready.
Right.
So
plus, you don't want to go through, if you're in that state, you're in the emergency room or in an ambulance, you're not going to be thinking about, who should I call for my next appointment? You just want, you're there, you're traumatized, and you want to be able to just, be better.
Yeah.
And you said you can even make the appointment, like you have QR codes, and you can even make the appointment while you're still like with the EMS, so that you have it, you get released and you have it like the next, within 48 hours.
Yeah, our
So that's
QR codes are like,
key.
you could do it for me or I could do it myself. There's 2 separate QR codes, and it can get done right now and get them in, and that referral goes to a lot of different places to make sure it goes to wherever you live. Maybe it happened here in Bellows Falls, but maybe you live in Burlington, and that's where you want to follow up with Savida. Then we get you there.
So how many offices do you have in the state?
So we have 9 now. So at the top in the Northeast Kingdom, we have Newport, Morrisville, and then in the south we have St. Albans, Burlington, Virgins, Springfield, Brattleboro, Bennington, and now Bellows Falls.
Oh,
Our
yes,
new
that's
satellite.
amazing.
Right here in the health center.
Yeah.
Everyone knows the health center at One Hospital Court. It's right across from the check-in location for physical therapy. The office is right there. You can come in. You are open, well, you have to have an appointment, but Mondays 4 to 6 and Thursdays 2 to 4. If you want to keep Savida here, we need to have you take advantage of the fact that they were willing to open up to serve the community, to be it seems like accessibility is kind of your thing.
It is.
Breaking those barriers down for people to get to treatment when they need treatment, and conveniently located.
It really is. I mean, the partnership we have with like the recovery centers, I tell them, if you can't get a hold of the center, call me personally and I'll make sure you get in. Honestly, they've got in every time. I'm like, if they're ready now, we're ready now. Just call us. Rather it's EMS or anybody. Yeah.
So working in the field, what do you think we're winning at all, or where do you?
I think
it's a tough question.
It is a tough question. I think there are areas that we're winning and areas that maybe we're not. I think I know it was related to the floods back in the day, but the motto of Vermont Strong, I think that does apply here. I think this community is all in, rather it be Savida staff, BART, which is, they do primarily methadone, that, the Turning Points and in Valley Vista and all of those folks, Divided Sky. I mean, there's so many. I think we're all in it for the right reasons, and we're trying to work really hard. Even the state of Vermont with their blueprint model, they're very supportive to MOUD treatment. And I think that we're doing really well, but there's always more we could do. And pushing legislation like this is important, Another thing that I think we're doing well is like the SIM model. And that's working with the judicial system and having them a part of our meetings.
Is SIM an
now.
acronym for?
It is Sequential Intercept Model.
Oh my gosh,
man.
that's a toughie.
I know. So that's when you're bringing in the judges, the officers that are out on the street, and we're all working together and talking about it instead of it being us. Kind of sometimes where it feels like versus them.
Yeah.
And it's been
Good.
really positive.
Yeah.
They've been amazing. You know, Monica Hutt, she's a prevention officer for Vermont. She's been so active in helping, you know, with all of this. And I think it's just, I think Vermont in many ways is a model to others, even though I'm from the West Coast. I really do. I think there's a lot of things we're doing right, and there's a lot of things we could do better. You know, the stigma is still a big thing. You know, you hear the words that, you know, as a mother of a child suffering with this disorder, you know, I don't want people to say those things about my kid, but you still hear it in the treatments and the attitudes, and some of the things I've heard are pretty awful.
Well, I think one of the things that's unique about Vermont is that it's not flat, but it's the people are sort of flat. It's like the distance between a person on the street and the governor is really not very far. It's like you could pretty much talk with all your representatives. You know them. You see them in the street. You see them on the, you know, in the shopping center, and you talk with them. So there isn't like a big bureaucracy. So I think that makes a big difference as far as being both empathetic and agile as far as doing treatment. Yeah.
I would agree with you 100%. Yeah, coming from a big state with big government, well, you just walk right in. They're like, hi.
I know you. It's like you.
Yeah, it's so personable. I totally
Yes,
agree with
I
you.
know.
Yeah.
Is the other big thing the proliferation of Narcan? I mean, it seems like it hasn't been that long since Narcan came out. It was 10 years ago, maybe?
Yeah, so we do provide Narcan, as a lot of folks do. And, you know, we were talking about this earlier. Narcan has become so widely spread out that the majority of overdoses are actually being treated by people like you and I.
Yeah,
Out on the
that's
streets,
amazing.
not EMS. Because everybody has it. Like when we had Purell for COVID, right? Everybody has Narcan. Most people I know have it that don't even work in recovery. They just happen to have it in their bag. And I think that's made a big difference. You know, just
As far
not
as
waiting
saving
for
lives,
EMS.
yeah.
Right. Like we're right there right now. We
Yeah.
don't, you know, call them and treat at the same time.
Is there a benefit to the quicker that someone is treated?
Yes. Yes. Now, not being a provider or, you know, an RN, but yes, the faster the better, just like with anything, like if you're having cardio.
Right.
Yeah.
Yeah.
Same
Yeah.
thing.
Yeah.
Can you speak to, I think we have a slide on this, it's be the Savida, the what MAT and the, like what it does, like what does medically assisted treatment do? Like why would, what
How
is
does
the
it
benefit?
differ from
How does it
other-
differ, yeah.
Yeah, so everyone's recovery is different. So some people might, you know, not want medicine, some might want the methadone route, and some might choose Suboxone. And so what it does is it helps initially, of course, with the detox when you're coming, you know, down from whatever, you know, opiate that you're on, or alcohol. Vivitrol treats alcohol, so it helps with the detox process, but then it also helps with the cravings. And so that's literally what its purpose is. Savida does a little bit more than that. You know, we have counselors at our centers and RNs that help with not only the RN things, but also case management and things like that. But that's what it does. And so that's why you would go there, is you would want, you know, to have something that's going to help you. Just like you would if you have depression, you're going to want to take an antidepressant medicine to help you with that. Or if you have heart disease, you're going to take whatever medicines, you know, necessary for that.
So it's time that we maybe normalize
Yeah.
this treatment as it's a treatment, because we're treating a disease.
Yeah.
Somebody has a disease, and I think we're getting there, but
Yeah.
it's still not, we're not quite there yet.
Well, and I think it's important to recognize what it does do. You know, when I started with Savida, the CEO had tasked us to see how many of our patients were working. And so we did that. And for the state of Vermont, 60% of our patients work. And that's not to say that 40 just aren't. They could be stay-at-home parents. They could be retired. They could be on disability. You know, we don't know. We just see who's employed. And I think that speaks volumes about recovery, right?
Because they're
yes.
functioning.
That's-
They're functioning in society and contributing to society.
Yes, and that's the goal, right? I mean, Yeah, so I'm really proud of that, that's where we're at. We can only go up.
Mm-hmm. So the things that you were just talking about, the counseling and all that, that's what you talk about with wraparound services.
Yes.
So there's a lot that you do.
Yes, we do. So we're part of the Blueprint, as are several communities in Vermont. It's not just for recovery, but that is the portion I'm part of. The Spoke program is what they call it. And so the state of Vermont lets us and reimburses us for Spoke services, and we agree that we'll have a registered nurse and we'll have a counselor. And the beauty of it is, so we have these in-house. It doesn't matter if you have Blue Cross Blue Shield, if you don't have insurance, or if you're Medicaid, you get all the wraparound services. It's not segregated to one group, and so it's a beautiful thing. Yeah.
And all with like one-stop shopping.
Yes.
Like within Savida. So you're not getting your Suboxone here, going somewhere else to talk to a counselor, and then somewhere else to check whatever needs to be checked. It's all within Savida.
Yes.
Your one-stop shopping.
Absolutely.
Okay. I think that's important for people to know too, because sometimes there might be I don't want one more person I have to go to, but it seems like you can go to one place and have everything taken care of.
Yeah, absolutely.
It's good. I'd like to emphasize the walk-in services here because I think that's really important, because you don't have to get to Bennington, or you don't have to get to Brattleboro, or you don't even have to get to Springfield. If you're in Bellows Falls, you can get treatment right here just by walking, and it's not far.
Or the mover. The mover still comes
by
up,
there
even
all
though
the
there's not as much going on in the building. There still is. We still have all of our other tenants here, so the mover still comes up, and they come up on a regular level. So that's another. That was always a big thing for our location, is that people, could just be dropped off right in front on the mover.
Yeah, it's important. I mean, because so many of our folks, aren't driving, and there's not always buses, and buses could take up half your day, like you mentioned earlier. Yeah.
And that was one thing that I was in on a meeting with there was talking about community health assessment needs, the needs for community health, and what most boots on the ground practitioners, folks that, like for Turning Point, people that are like, on the ground with folks, said that the biggest problem is accessibility to services, because they were telling stories about how complicated it is to take the bus. And you might get there on an early morning bus, but there's no afternoon bus, so you're stuck wherever you go for a majority of the day. And yes, it does interfere if you're trying to work.
Yeah. How could you? If you spend all day on the bus, how could you even work? You can't.
No.
And then if you are able to, like, let's say you get once a week, you got to tell your employer you need every Monday off. Why? Like, you shouldn't have to tell them that.
Yeah. That's a really important point. Yeah.
So we have just about 2 minutes left. So is there anything else you want the audience to know about Savida?
Just that, and I say this a lot, so I'm sure so many people have heard it, but one of the things I value most about Savida is the way that the patients say they're treated, like it's a PCP, like they're normal, which is both encouraging and sad at the same time. Again, I have a child in recovery, and so I've watched it firsthand, even on my day one with the company, is you come in, and if you return to use, you're getting a hug and let's start over. You're not getting and I think that's what's really puts us apart, is the feeling of, this is just my treatment and they care about me just like my doctor does, and I'm going to go in and see my buddies and get what I need and go home. And so I think that's just the most important part of what Savida Health is, really.
Yeah, that's very good. I liked your closing graphic on the film. It was 2 people hiking together, but one giving another a hand up.
Yeah, absolutely.
And that's I think that comes through definitely on your website, and again on your Facebook page, the very human element of what you do.
Thank you.
So located at One Hospital Court, right here at the health center. You can go to savidahealth.com, or you can call 802-231-4486. That was the number that was listed for that.
Yep.
So,
Thank you for coming on.
Thank you so much.
Maybe we can come back and talk a little more about this at another time. But yeah, great.
Thank you so
Good
much for
having you
having
here.
me. This was very nice.
And that's it for this week.
Bye.
We'll see
Bye,
you.
Katie.